Multiple cases of novel H1N1 reappear in Scripps Ranch in late September. Early cases are not recognized as influenza and are treated conservatively, affording the opportunity for transmission to schoolmates and family. The vaccine for the novel H1N1 will not be ready for distribution in large volumes until late October.
And because of this, we need to stand up our command post. We will take the incident and manage it as we move forward. At any time that we need to expand the incident command staff, what I will do is communicate that out through the section chiefs, and Section Chief Nancy will determine if it's appropriate to relay that information to staff. Are there any questions right now?
If you'd like to utilize those, and again, the signs could be changed. There's quite a few patients in the waiting room that need to be triaged. One idea I had, but I'm open to other suggestions, is that perhaps the OR could be used for the most severe patients. We could put quite a few patients in that area. And if they are not as severe and could be discharged, they could actually walk down this hall. They could pick up their antivirals right at the pharmacy, and they could head out of the hospital. But I'm open to other suggestions. Don't forget to wash your hands. There is personal protective equipment back against the wall. Make sure you protect your mucous membranes, wearing a mask and gloves and goggles.
I was thinking this time we would use the ESI triage.
Yeah, that seems to work better for flu type stuff.
Who wants to be in charge today, as in a regular charge nurse role? Where is the area that we can use as the OR? The OR area that we'll use for critical care?
Nancy, it's down this way, just around the corner here.
Where is it past the pharmacy?
It's on your left is the OR area, and then all of these beds have been made available to us on the right as well.
Our section here then, right?
Right. So, Lorenzo, you want to assign which rooms would be ESI 3 or 5?
Okay, the situation at hand right now, Nancy?
The situation at hand right now is we have a bunch of patients in our waiting room, and we're setting up our surge area.
Okay.
Lorenzo, do you want to assign who the two departments would like to be in triage? Who would be the minor area? When we did the last drill, it seemed like it was better to have everybody start at triage and then assign people to spaces after we saw kind of what we were dealing with.
Okay.
It's reasonable. We only have 3 nurses, so one's going to have to be in triage, one in the hall, and one in the OR eventually.
Okay, I think that one of the things we could do is assign somebody to the minor area where we're still sending the 4s and 5s who's not a nurse.
That's a good idea. All they need is directions. They're not going to need a lot of medical care. So,
and I would guess in this scenario we would have a pharmacist. So how about we assign the pharmacist to the minor treatment area?
Okay.
So at this point, too, Eric, we are going to need more nursing staff.
At this time, the only resources we have are to help us out with that. It's going to be the group that's on hand.
The best thing the best way to use you and utilize you would be to have you transport patients after they have been triaged to the appropriate area. So all Cat 3s will go in the hall, and all Cat 2s will end up going in the OR. All Cat 4s and Cat 5s will end up going towards the pharmacy area, and I'll be helping you with that.
Okay, got it.
Hurts, and
What exam room are you going to be taking, or triage room?
Lorenzo, we need to make a separate area for medical patients.
Do you want to separate and use these front rooms for medical purposes, or should we use the ones? I think the ones in the back should be better for the flu patients then.
I agree. Anybody else got any suggestions?
As the logistics chief, I can tell you that there is another holding area at the end of the hallway, so there is a separate holding seating area if you wish to use that.
Use that as the flu then, and keep the hall for medical?
That's your call.
Is it possible to have negative pressure in all of those rooms there that are down the hall?
Yes, we could use the rooms, the Cat 3 rooms for negative pressure.
And the Cat 2 rooms as well in the OR?
Not so much the Cat 2, just the Cat 3s.
Yeah, is there a way we can clear the hallways so it won't be as crowded?
Now, it looks like at the end of the hall, we could probably use it for medical patients and try to put in all the flu patient extra rooms with the reverse isolation here in the hall instead of using them for all Cat 3s.
Sounds good. Could everybody find their way around?
Where's the OR again for the critical care patient?
Across from the Cat 3 rooms, over here, through this door on the right.
I'm a little bit worried about Tanya here. I just checked her vitals, and I think her systolic's 89.
Yeah. Have you started triaging yet? Has anybody started triaging? Not yet. Okay.
Lorenzo, I'm going to go help in triage if you're going to finish that
Situation update. When Nancy's in the middle of it, so that's stuff for her. But can you give me a brief of what's going on?
We are still trying to figure out which rooms to categorize for the triage. As far as I can tell right now, we're going to do negative pressure on the hallway rooms, 141 to 144. We're going to use the area outside the cafeteria for med triage, and the Cat 2s will be in the surgery suites.
The staff are beginning to triage the patient. We'll have a better idea when some of the triage is done, how sick the patients are and what needs we're going to need for ventilators and further medical care.
Great, then I'll wait to hear from you on that. If we could have an update in 5 minutes.
That's if they're not Cat 4s and Cat 5s, correct? Because we're treating them outpatient also.
Can I help you?
Hi. Oh, I have a cough and a sore throat, and I've had this fever for 4 days, and it won't go away no matter what I do.
I have a lady that I'm leading now with tachypnea and 88% SATs. I think I might take her to the OR.
Okay.
We have one person.
How can I help you?
Might need a
Yeah, this
ventilator.
morning with just cancer.
Reverse isolation.
And use any room in front of it, because the one with the 0 in front of it is for medical only.
Okay, so go across the hall.
I have had no reports.
You're in the right place. 5 in the OR. We have 4 right now that are flu, and 3 that are medical. The medical ones are in OR C, and OR A and B are the flu ones.
Thank you. I'm going to go back out and help in triage.
So we have plenty of space back there for medical patients.
We have one patient in this room.
About 6 or 7 isolation Cat 2 patients, so the OR is getting overcrowded.
That's correct. We could switch another room. I will ask the instant commander if there's space in the ICU.
Hello, everybody. If we could all meet at the nurse's station now.
Just give everybody a mask.
It's right there. Every time I go in, I see it, and go out, I see it. And maybe if we can put it outside the room.
This is a much bigger ED.